Hello and welcome back to Animal Sciences 142. In today's lecture we're going to talk about the appendicular skeleton, which of course covers the appendages and the pelvic and pectoral girdles. Now after you complete today's lecture you should be able to distinguish the difference between axial and appendicular skeletons. You should also be able to list the elements of the appendicular skeleton and identify all the bones and the common processes, holes, foramina, etc. You should also be able to tell me about the different types of joints and identify joint movements. So we're going to start out with the thoracic limb. The thoracic limb, otherwise known as the front leg, starts with the scapula, the humerus, the radius, the ulna, the carpals, the metacarpals, and of course the phalanges. Also part of the pectoral girdle is the clavicle, when we have one. Cats have very small, sort of toothpick-like clavicles, and dogs don't have clavicles at all. So I was saying in the last slide that cats sometimes have a small little clavicle. Dogs don't tend to have clavicles at all. Just want to show you a picture of what a kitty cat clavicle looks like. And this is blown up many times. And so you can see it's a very flimsy bone. It's really more of an intermuscular bone than a bone that actually does anything. To the left of that is another bone that's still very important, but we're not going to show it later on, and that's the patella. The patella, otherwise known as a kneecap, is a sesamoid bone that helps to protect the joint between the femur and the tibia. Okay, the next bone in the pectoral girdle is the humerus. The humerus is the longest long bone in the pectoral girdle. It's also one of the strongest bones. And so the humerus articulates proximally with the glenoid fossa of the scapula, and also it articulates distally with the radius and ulna. So let's look at that proximal connection. The proximal connection here is going to be the head of the humerus, shown here, with the glenoid fossa, sort of concave cavity on the scapula. On the proximal end, you can also see something called the greater and lesser tubercles, and you can also see something called the deltoid tuberosity. A tuberosity is a raised hill or rough patch. In this case, this is going to be an attachment site for the deltoid muscle. You can also see an intercondylar fossa. This is important because this fossa allows some of the tendons of the biceps muscles to run through there. On the distal end of the humerus, we have a couple structures of note. We have our trochlea and capitulum. These are rounded condyles that articulate with the ulna and radius respectively. So the trochlea articulates with the ulna, and the capitate articulates with the radius. On the back side, you can also see something called the olecranon fossa. Remember, a fossa is a depression, and this depression allows the olecranon process of the ulna to extend into the olecranon fossa, so its animal can extend its elbow to the full extent. So in the last slide we said that the first part of the arm is the brachium and it only contains the humerus. Well, the arm distal to the elbow is called the antebrachium, and we also call this the forearm. And the antebrachium in most vertebrates, or at least most mammals, is going to have two bones, a radius and an ulna. And the reason why we have two bones in there is it allows a little bit of mobility, a little bit of pronation and supination, although usually not to the extent that we have in humans. So the radius is one of the bones of the antebrachium, and it articulates proximally with the humerus by touching the capitulum, and it articulates distally with the carpal bones of the wrist. So some things you need to know about the radius. If you look at the top of the radius, you're going to see a shape on top, and it's a circle. And if you ever can't remember what this bone is, just remember that what does a circle have? That's right, a circle has a radius. And so the radius is the only bone that I know of that has a nice circular head to it. Now, on the distal side, you see something that is a styloid process. Now, the styloid process is a connection point for muscles and things like that. And then on the shaft of the radius, you can see that we have tuberosity or rough patch as well, called the radial tuberosity. It's attachment sites, again, for muscles. Okay, the next bone of the antebrachium is called the ulna, and the ulna has a much firmer connection with the humerus than the radius does. You can see the large slot at the top there. This is called the trochlear fossa, and the trochlear fossa articulates very tightly with the trochlea, which is the rounded projection on the distal end of the humerus. Other notable parts of the bone you need to know about is the olecranon process. This was that part, if you feel your elbow or your funny bone, you ever hit your funny bone, that's actually called your olecranon process. So now you know the real name. And anyway, the olecranon process is basically inserted into the olecranon fossa of the humerus when the elbow is extended. Now, on either side of the trochlear notch, there are two sort of pinnacles, one of which is called the coronoid process, and the other one is called the anconeal process. And these basically help to deepen the trochlear notch and reduce the chances that the ulna is going to luxate away from the trochlea of the humerus. If we take a look at the distal end, just like on the radius, we have a styloid process, a little pointy part for muscle attachment. Now, a disorder that affects the anconeal process is something called an ununited anconeal process. Basically, what happens in all breeds is the anconeal process actually starts out not being part of the ulna, but during development, it grabs onto the ulna and becomes a solid part of the socket that articulates with the trochlea. However, in some breeds, for whatever reason, it doesn't fully unite. In this case, we say that the animal has an ununited anconeal process, or UAP. And this can be very problematic because it does cause a lot of pain and lameness. We even call this elbow dysplasia. And there are breed predispositions. For example, St. Bernards and also German Shepherds are prone to UAP. And the way that it's treated is basically to go in there surgically and either reattach the anconeal process or remove it altogether. But either way, usually the elbow will be still somewhat lame for the rest of the animal's life. Now, to confuse things just a little bit, the radius and ulna in the horse are not two separate bones. They're actually fused into one bone. The majority of that bone being the radius, which we can see here, and the part at the proximal end here is a part of the olecranon process, the ulna. So, unlike what we see in most mammals, where the ulna actually bears a lot of the weight, here it's the radius in the horse that's bearing the weight, and the ulna is reduced to the olecranon process that we see here. Okay, and then at the distal end of the antebrachium, we have the carpus, the metacarpus, and the phalanges. Now remember, the carpus is just a name for the wrist and all the little bones that are in the wrist. And here you can see we have 1, 2, 3, 4, 5, 6, 7, 8. That's a lot of different bones. So anytime you see lots of tiny little bones, know that they're very delicate, they're prone to injury, but it also gives us a great amount of mobility. So if you look at a cat and think about all the different motions it can do with its wrist, right? It can swat at things and stick its little feet under the door. They're very, very flexible, and that's because they have lots of little bones in there that gives us great flexibility, but not so much support. The other bones we have here are the metacarpals. The metacarpals are the long bones of what we'd say the palm. So if you look at your own palm before your fingers branch out, those are your metacarpals. And at the end there we have our phalanges. So the phalanges, we have 3 parts to each digit except for digit number 1. And we say that those parts are the proximal phalange, the middle phalange, and the distal phalange. So the distal phalange is the part here that is bearing the claws. And now here's a radiograph or x-ray where you can see those same bones. Again, the carpals are the wrist bones, the metacarpus is the bones of the palms, and then the phalanges are the bones of the digits. Except for horses. Of course, horses just have to be weird because they have to be different. They're horses. So let's take a look at the digits of the horse. Now, first let's go look at the photo at right, which shows basically the digits of a mammal we all know, which is a human being, Homo sapiens. And here we can see the carpal bones, the bones of the wrist, the metacarpal bones, the bones of the palm, and then the phalanges that we have there. And we have a proximal, middle, and distal phalange. But let's look at a horse. Okay, horses are walking differently than what we think they're walking. And so we can see the brown bone there is the coffin bone. That corresponds to the distal phalanx and the human. The pink bone there corresponds to the middle phalanx of the human, and the green bone corresponds to the proximal phalanx. The yellow bone is the metacarpal, and the blue bones here is the carpus. So basically, horses are a lot different than the other animals in that they're walking around on their middle fingers. And if you know anything about horses and how temperamental they can be, that really makes sense. They're just sort of walking around going, "F you, I'm a horse." Okay, so now we're going to take a look at the bones of the appendicular skeleton. So this includes things like the ilium, ischium, and pelvis, which make up the coxal bones, as well as the tibia, fibula, femur, tarsals, metatarsals, phalanges, etc. The first bone of the appendicular skeleton is the pelvis, otherwise known as the hip bones, and it's actually a combination of three bones. It's made up of the ilium, the ischium, and the pubis. So important parts of the hip bones include the acetabulum. The acetabulum is basically the socket for the head of the femur, and you can see that it's a very, very deep socket, and that means that dislocations or luxations of the hip joint are fairly rare. Also in there you can see a large hole called the obturator foramen. This basically doesn't have much of a purpose except that it helps to lighten the weight of the pelvic girdle. Up top you can also see the wings of the ilium. Again, if you put your hand on your hips, you're putting your hand on the ala, or the wings of the ilium. And then down at the bottom is the ischium and the ischial tuberosities. Like other tuberosities, the ischial tuberosity is an important attachment site for, that's right, muscles. In this case, muscles of the buttocks and also the hamstrings muscles. Alright, our next bone is a bone you should already know. It's the femur. It's probably one of the longest and strongest bones in the body. And the femur articulates proximally with the pelvis, and it articulates distally with the tibia. And so up top you can see the head of the femur is made to go in that deep socket in the acetabulum of the pelvis. We also see two other projections here called the greater and lesser trochanters. And the trochanters are again attachment sites for muscles, which we'll learn about in the next chapter. We also have something called the linea aspera, which is an important attachment site for some of the gluteal muscles. And then finally, if you go down the shaft of the bone, or diaphysis, and move down towards the distal epiphysis, that is the distal end, we can see that we have two condyles on here, a lateral and medial condyle, and these articulate with complementary depressions on the head of the tibia. In between the condyles, we have something called the intercondylar fossa. The last thing you should notice is something called the patellar groove, and as the name implies, this is the groove where the patella or kneecap lies as it rides back and forth against the distal end of the femur. So most of you have probably heard about the condition called hip dysplasia, and this is a condition that's caused by a variety of factors. Certainly nutrition, exercise, but also genetics play a factor. Basically, in a normal dog, if we look at a hip x-ray, you can see that the head of the femur fits very tightly up in the acetabulum. Now, this is held in place by soft tissues and ligaments, and there's a lot of cartilage and other connective tissue in there that sort of cushions the head of the femur in the acetabulum. However, if we have a dog that has hip dysplasia, you can see that the joint is much more loose. There's a lot more space between the head of the femur and the acetabulum, and so a process called subluxation occurs. Basically, the bones come out of position from each other, and when they do rub against each other, they cause a lot of friction, and that friction causes inflammation, and eventually we get osteoarthritis there, which becomes very painful for the dog. It reduces its range of motion. It also causes them to limp and basically become quite lame. So as we've already said, genetics plays a factor, as does exercise and nutrition. Larger dogs tend to be more prone to get hip dysplasia than smaller dogs. So we're talking about our Labrador Retrievers, our German Shepherds, Rottweilers, etc. But also obese dogs are more likely to get hip dysplasia. You'll learn a lot more about this when you go on to take the Animal Behavior Diseases class. Now, just like the antebrachium, the lower leg is made up of two bones instead of one. So the two bones we're talking about here are the tibia and the fibula. Now, by far, the tibia is the most important weight-bearing bone of the lower leg. You can see that approximately it has a very wide head that has what we call condyles, but here these condyles are actually concavities that are complementary to the large rounded condyles of the femur. Other features of the tibia include the tibial tuberosity. Okay, this is an important attachment site for, you guessed it, muscles. And then distally, you can see something called the medial malleolus. The malleolus is that little bone that you feel in your ankle. For example, run your hand down the inside of your ankle and you can feel that bump right there. That's the medial malleolus, and that's a process that's part of the tibia. On the other hand, the lateral malleolus, which you can feel on the outside of your ankle, is actually a projection of the second bone of the leg here, which is the fibula. And so you can already see that the fibula is a much smaller, less substantial bone than the tibia. It bears hardly any weight at all. And in fact, if we look at horses and stuff, the fibula is basically just a remnant and bears no weight. And so the fibula has this lateral malleolus, it has a head, and also a very long and slender shaft. It articulates proximally with the tibia and distally with the tarsal bones. Okay, now on to the hind foot. Now, just like the forefoot, we have lots of tiny bones in the ankle, except instead of being called carpal bones, they're called tarsal bones. And so the important bones you need to know here are the calcaneus, which is the ankle bone. This bone connects with the gastrocnemius or calf muscle. There's also the talus, which is a rounded bone that articulates with the tibia. And then we have the cuneiforms, the cuboids, and naviculars. Now, beyond those tarsal bones, we have metatarsals instead of metacarpals. And so you can see they're very long bones. They're a lot longer than what we had in the foreleg. And then beyond that, you can see we have 4 sets of phalanges, and each one has a proximal, middle, and distal phalange. Now, I just want to point out some important differences between the feline foot and then the equine foot. Now, felines, first of all, walk different than humans. Humans walk with their metatarsals and also their calcaneus touching the ground, and we call that plantigrade walking. Felines and canines, on the other hand, have digitigrade walking. That is, they're walking with their metacarpals elevated off the ground, and the only thing that's really touching the ground are the phalanges. So they're kind of like walking on their tiptoes. And then we see horses. And again, horses are weird because they just are. So horses, again, are walking on that one middle finger, and they're walking on the distal phalanx of that middle finger. So the distal phalanx there, otherwise called the coffin bone, and then we have our short pastern bone, which is our middle phalanx, and then our long pastern bone, which is our proximal phalanx. So they're literally putting a lot of weight on this single digit that's touching the ground, and that happens to be digit number 3, the horse's middle finger. So in the last slide we did say that horses are walking around on their middle finger, which is quite bizarre. So what happened to the other fingers? Well, I'll show you. Take a look up at the top right and you can see some bones that are called splint bones. These are the vestiges of digits 2 and 4. Remember that the horse is walking around on digit 3, and we can see the vestiges here of the metacarpals 2 and 4, and these are called splint bones. So horses are weird, but what about cows? Well, cows and other cloven-footed organisms have actually 2 digits on the ground, and these are digits 3 and 4. On the other hand, we do have digits 2 and 5, but these are vestiges which are called dew claws. Okay, now that we've talked about the appendicular skeleton, we're going to spend a few minutes talking about the visceral skeleton. Now, remember that viscera means organs, and so visceral bones are bones that are actually found in organs. It's so weird. Humans don't have them, but some animals do. For example, the os cordis is a bone that is found within the heart of cattle and sheep. On the other hand, the os penis or baculum is a bone that is found in the penis of dogs, beavers, raccoons, and walruses, and it's a supporting bone that helps to hold the penis erect. And finally, swine or pigs have something called the os rostri. Remember, the rostrum is the nose, so the os rostri helps to support the nose or snout. Okay, so we said in the last slide that the os penis was also called the baculum, and baculums in dogs tend to be fairly small supporting bones, whereas in walruses they tend to be very large, up to 2 feet in length. In fact, Eskimos and other tribal cultures would actually carve them into, curios, and sometimes are even rumored to be used as clubs by people that were harvesting fur seals, and they would use them to club the baby fur seals into submission so that they didn't damage the rest of the coat. It's disgusting, I know, but it's interesting to think about the different uses that some cultures had for these penis bones, otherwise known as the baculum. So now that we've talked about the different elements of the appendicular skeleton and visceral skeleton, we're going to move on to talk about joints. A joint is a junction between 2 bones, and another name for a joint is an arthrosis. And so generally there's 3 classifications for joints. Fibrous joints, which tend to be immovable, cartilaginous joints, which are slightly movable, and synovial joints, which are freely movable. Okay, our first joint here is the fibrous joints. Now, fibrous joints are where two bones are joined together by fibrous connective tissue, and usually these are immovable, that is, they are synarthrotic. An example of a fibrous joint would be the sutures between the different bones that make up the cranium. For example, the left and right parietal bones are joined by fibrous connective tissue to make up the sagittal suture. In adult animals, these bones are immovable, and so they are classified as synarthrotic fibrous joints. Our next joint is the cartilaginous joint. This is where two bones are joined together by cartilage, either hyaline cartilage or sometimes fibrocartilage. And these tend to be amphiarthrotic, that is, only slightly movable. An example of a cartilaginous joint is found in the mandibular symphysis of some mammals. That is, in between the left and right halves of the mandible, we have a small piece of cartilage that allows slight movement. Other examples include the discs in between individual vertebrae. Now, these vertebral discs are made of fibrocartilage, and even though the spine tends to be very movable, if we look at the joints between adjacent vertebrae, they're only slightly movable, and that's why we call them amphiarthroses. Our third joint category is the synovial joints. Now, synovial joints are the joints that you think of when you think of joints, such as the elbow, the wrist, the hip. These are freely movable joints, so they're called diarthrotic or diarthroses. That means freely movable. And they have a very complex anatomy. Each of the bones in the joint is covered with an articular cartilage made of hyaline cartilage, and this helps to reduce friction as the bones move against one another. They're also encased in a capsule of dense, irregular fibrous connective tissue, and within that capsule we have lots of synovial fluid. And synovial fluid is sort of like oil, and that again helps to reduce friction between moving bones. Now, this capsule is reinforced by ligaments, which are fibrous connective tissue structures that connect bones to other bones and help to limit the range of motion and mobility. Okay, now we're going to spend a few minutes talking about different synovial joint movements such as flexion, extension, abduction, adduction, etc. Now, these are important not just for this chapter, but also for the next chapter on muscles, because for muscles you're going to have to learn to identify the muscles, tell me their origins, insertions, but also tell me their actions. For example, we'd say the biceps brachii muscle is responsible for flexion of the elbow. Okay, our first two movements here are flexion and extension, and these are opposite movements. So flexion is a movement that results in a decrease in the angle between two bones. For example, at lower left you can see an example of flexion of the horse's knee. When it's flexed, the angle between the cannon bone and the radius is about 90 degrees. On the other hand, when it's extended, the angle is approximately 180 degrees. So extension increases the angle, flexion decreases the angle. Now, abduction and adduction are also two opposite joint movements. Abduction is the movement of a limb away from the midline, whereas adduction is the return of that limb back to the midline. And the way that I remember it is, think about abducting a baby. If you're abducting a baby, you're taking it away. On the other hand, adduction has ADD in the word, which means we're adding the limb back to the body. Adduction. And then we have two circular movements, rotation and circumduction. Rotation is the twisting movement of a bone part on its own axis. For example, think about turning your head from left to right. This would be an example of rotation. On the other hand, circumduction is the movement of an extremity, so an arm or a leg, so that the distal end moves in a circle. This would be like if you're putting your hand out and moving it in one big circular arc. Obviously, you don't see horses doing this a whole lot, but sometimes you'll see a cat do a little bit of circumduction, and that's because they have this nice ball and socket joint in their shoulder that permits this circular movement. Now we're going to go look at some common types of synovial joints. Okay, our next type of synovial joint is a hinge joint. Here we have two bones that are connected together, and the articulating surfaces on the first bone are convex, that is, they're nice and rounded, and the articulating surface on the second bone is concave, that is, it's a depression. And so the mound on one bone meets up with the depression on the other bone to make this uniaxial hinge joint. And the example we have here is the elbow. So take a look at your dog's elbow or your own elbow. And this is the joint between the humerus and also the ulna. And so the elbow can extend, it can flex, but it can only do so in one plane. So we say that it's uniaxial. The next joint we have is something called a planar joint. Now, unlike the hinge joint where we had flexion and extension possible, the angles between these articulating bones do not change, but they do slide past one another. And so they're primarily capable of flexion and extension, but sometimes also abduction and adduction. And the example here that we have is the carpus. Now remember, the carpus of a horse is what we call the knee, and it can flex and extend. Can't really abduct or adduct that much though. Okay, the next joint we have here is a pivot joint. In a pivot joint, we have a rounded surface of one bone which is articulating with a ring formed by a second bone or a ligament attached to that bone. And the movement here is uniaxial rotation, that is, rotation around a single longitudinal axis. So an example here is the radial ulnar joint, that is the joint between the radius and the ulna of the foreleg. And in people, we can actually supinate and pronate that limb to where we can place our palm upwards or downwards. Now, dogs can't really do this, and certainly horses can't, but cats can get a little bit of supination going on if they're trying to swat at a toy or something like that. Another example of a pivot joint is the atlantoaxial joint. This is the joint between the first and second cervical vertebrae, and this allows the animal to rotate its head to the left or to the right. So when your dog tilts its head up to the left and it looks at you quizzically, he's using his atlantoaxial joint, which is an example of a pivot joint. On the other hand, with ball and socket joints, we have two articulating bones, and one of those bones has a large concavity in it, or socket, and the other bone has a large rounded projection, which is called the head of the bone. And these bones allow for multi-axial movement. They allow for flexion, extension, abduction, adduction, and also rotation around their axis. Examples include the shoulder joint, that is the joint between the scapula and the humerus, and the hip joint, that is the joint between the femur and the pelvis. Now, of these two ball and socket joints, the hip joint is much more secure. It has a much deeper cavity called the acetabulum, and into that acetabulum fits the head of the femur. And again, ball and socket joints allow for joint movement in many planes, for example, abduction, adduction, rotation, flexion, and extension. Okay, the next joint here is the condylar joint or condyloid joint, and the articulating surfaces here are oval-shaped projections fitting in an oval-shaped depression, and the movement is usually biaxial. So examples here are the joints between the phalanges, that is, the interphalangeal joints. An example of the movements permitted include flexion extension, so your animal can flex and extend its phalanges, and there's also a little abduction and adduction possible. So when your cat splays out its fingers if it's swatting at something, that's an example of abduction of the condylar joints. An example of a saddle joint is the carpometacarpal joint. That is the joint between the metacarpals of the thumb and the carpus of the wrist. And so this is a biaxial joint that allows for abduction and adduction as well as a little flexion and extension. Now, only humans and primates can do opposition, and that's where we're able to place the index finger against the thumb, which is really important for grasping things. And thank God that animals like your dog and cat cannot do this, because otherwise they'd be reaching into the refrigerator and opening doors and getting into all sorts of shenanigans. Okay, now that we've had an overview of the appendicular skeleton, the joints and joint movements, we're going to wrap up this lecture by talking about a few clinical and surgical procedures that are commonly performed on the bones of the appendicular skeleton. Alright, the first procedure we're going to discuss is something called radiography, and it's a procedure that is conducted in almost all veterinary clinics. And the common name for radiography is X-raying something. And we commonly radiograph animals to look at bones, to look at soft anatomy, and all sorts of things. It's probably the number one tool that veterinary clinics use to look inside the animal and examine its internal anatomy. Now, most of you have probably had radiographs taken of your own body at one point or another, but it's a little bit different in dogs and cats because generally they don't want to be there and you can't tell them what to do. So instead of just laying a patient on the table like you would with humans and saying, hold still while we take this radiograph, typically the veterinary technicians have to basically stretch the animal out on the x-ray table, position the columnator, and take the radiograph while they're standing in close approximation with the x-ray machine. For that reason, they have to wear a lot of protective garb, such as the lead vests and gloves that you see them wearing. So the results of our x-ray procedure is an image called a radiograph. A radiograph can either be film-based or more recently will be digital. So a lot of the clinics now are switching over to digital systems which take the image, don't use any film, and can store it on a computer and email it out to a specialist if need be. Now, radiographs are really good for looking at hard anatomy. For example, you can see the bones of the pelvis and also the proximal parts of the femur, but you can also see a little bit of soft anatomy if you look at the left side of the screen. So we can use these radiographs to look for fractures or luxations of bones, but we can also use them to look for foreign bodies within the intestinal tract. So if you go on to the second year of our program, you'll take a class that is dedicated to the art and science of radiography. Okay, the next procedure is a TPLO, or tibial plateau leveling osteotomy. Now, this is a surgical procedure typically performed on dogs that have ruptured their cranial cruciate ligament. Now, this ligament is analogous to the anterior cruciate ligament in humans, and when it's ruptured, it severely destabilizes the knee and causes lameness. Now, what the surgeon will do here is they will cut away the proximal part of the tibia and then rotate it downwards in order to change the angle from more of a slanty angle to more of a level angle with the articulation with the femur, and this helps to stabilize the knee joint and restore some range of motion and reduce the lameness that we typically see in dogs with ruptured CCLs. Okay, our last procedure is a contentious one, and it's called an onychectomy. This is commonly known as a declaw procedure, and it's commonly performed on cats. Now, I said it's contentious because the claws of cats are securely affixed to the distal phalanx, so it's not possible just to remove the claws. They actually have to go in and remove the distal phalanx. So that would be like somebody cutting off the last digit of each of your fingers. Now, that sounds like, why would I ever want to do that? And a lot of veterinarians won't do it, but there are some instances where it might be indicated. For example, if you have a cat that has just been clawing the crap out of somebody's house, so much so that they're getting ready to get rid of the cat, give it to a shelter, or just let it fare on its own. In these cases, the onychectomy may actually enable the cat to stay in the house, but it's something that should only be considered in extreme circumstances.